Hi, it's Dr. Meyer coming to you from East Bay Disc Centers in Concord, California. I am sitting here with two fantastic patients, Rebecca and Al. They came into us because Rebecca was having really bad lower back and leg pain for some time. A former patient who's had great results referred her in. During the exam, Al was there present and thought, you know what, it sounds like I should have you check me out for some things as well. He had some lower back issues, but more prevalently were a neck issue, and that his arms would fall asleep, his hands would fall asleep every time he laid down in bed. And so, of course, we sent you guys out for x-rays, right? That went pretty smoothly. You came back, we went over all the findings. We discovered that both of you have what we call degenerative disc disease. So the discs between the bones were getting dried up and smaller, and there was pressure on the nerves causing a lot of these symptoms. So we come up with a course of care. We're gonna do spinal decompression. No surgery, no drugs, just a natural physical approach. And we did it on the lower back for you, Rebecca, and we did it on your neck, Al.
Yes.
So I'm just going to start with Al because your story is shorter. It took how many visits before you felt marked improvement?
Actually, 2 visits.
Only 2 visits.
Only 2.
Now we know that wasn't enough to actually fix the underlying problem, but it was enough to get you symptom relief.
Yes.
Which was fantastic. And then you also said that quality of life, being able to maneuver your head. So for things like changing lanes, driving, just looking at someone who calls your name, big difference, right?
Yes.
Okay. So, and I mean, you're young, but you're not in your 30s anymore.
No.
So it's nice to be able to turn our body without restriction, without pain. And you're feeling great?
I feel fantastic.
Excellent. That's even better than great. Okay, Rebecca. Yours was a more challenging case for sure. You came in here, you were limping, it was terrible. You know, it just looked painful to even look at you while you're walking around. You would get on the decompression table and have the adjustments, and you would be saying to me, when am I going to get out of pain? So tell us couple of things that were really impacted.
Well, it was hard to get. I dreaded going to bed at night because the nights were long, and I had pain all night long. So
right.
There was no comfortable position. My leg hurt to lay on my left side. My back hurt. It was just awful.
And you told me that you were icing constantly throughout the night, right?
I was getting up and getting in the tub, a hot tub, 2-3 times a night.
And
so,
pain medications?
I was taking ibuprofen and Tylenol.
Which are just so healthy for you, right?
Yeah,
they would never damage your gut or anything. Right. Okay. So it took us substantially longer than Al, but we're now somewhere between 6 and 8 weeks into care, and you're feeling how?
Pain-free.
Oh my God.
Yeah.
Unbelievable.
Yeah.
Unbelievable. What would you guys tell anyone else that has anything remotely like what you've been experiencing, or what brought you in?
Well, I was scared to death to come to a chiropractor, so kudos to you.
No,
and
thanks.
I won't go anywhere else.
Thank you.
And it's been wonderful. I mean, this is the first time that I've had my back go out that I couldn't just make it go away after a week or so. So I knew it was something different.
And I'm going to throw in here that if we hadn't done the x-rays and a thorough exam like we did, we would never know that you had degenerative disc disease. And without knowing that, you might just say, hey, give me a couple of adjustments. Maybe I need to live on Advil for the rest of my life. And meanwhile, the problem keeps worsening. But if we identify it properly, we know how to treat it, and we can get to the root of it. So I feel confident you're going to be doing well for a long time to come. Yeah. Okay, I want to say thank you so much for being willing to do this on video and spread it around the globe. And it has been such a pleasure to have you guys as patients. You're amazing. And thank you for sharing. And I just look forward to you guys just even getting better than this. All right.